Hello everyone. Thank you very much for the invitation to take part in your virtual patient organisation networking day. I should first say congratulations to Isabel for an amazing tenure as chair of ELF, and I look forward very much to working with KELD in future. As you can see, I'm Anita Simonds, the incoming president. Just briefly, my background is as a clinician and researcher with particular interest in ventilatory support. Through that, I was involved frontline in COVID for some busy months from April through to June this year. And from a ERS perspective, I have a background of being Education Council Chair. I've been editor of one of the ERS's journals, the new journal ERJ Open Research, worked on a number of handbooks, also organised some of the congresses, the Mechanical Ventilation Congress earlier this year, the Sleep and Breathing Congress, and NIV courses for as long as I can remember. From a specific patient perspective, I'm trustee of the Scoliosis Association UK, and also an advisor to the Myotubular Trust. And myotubular myopathy is a rare neuromuscular condition, and I've always had a particular interest in arts and music. I was really glad to see the ELF strategy as it emerged. I think your values go without saying, although sometimes things that go without saying have to be said again. So they're important, and I'm really encouraged and glad that the topics align very well with the topics for the coming 2 years, and that of course is hugely important. So for the presidential themes for the coming year, the key ones are a focus on digital respiratory health, on spreading the word. The ERS does a huge amount of important work, but that word has to be spread and policies have to be implemented, and the ways of doing that are via the WHO, particularly our newer links with WHO Europe, work with the European Medicines Agency, with the Federation of International Respiratory Societies, and also via advocacy and our EU link and link to the EU MEPs. I also want to have a particular focus, as I suspect you do, on working across the multidisciplinary team rather than just silos of doctors and nurses and patients, so that this is joined up and a constant feedback loop. And of course, patients, carers, families and their advocates are absolutely key to that. And then finally, it's often that new people coming in sweep away what's been done before, and I always find that intensely annoying and wasteful. And there are key areas that it's really important to maintain the continuity of, and that is the Green Sustainable Agenda and all the work that's been done this year on diversity and ensuring the momentum is maintained. So just in brief on several of those areas, for digital health, we already have a digital task force which has been working over the last year, focusing on e-health. We have an m-health team in the part of one of the assemblies. And we need to integrate this work, understanding what's being done digitally within the ERS, making sure that's streamlined, but also outside. And that is through working across a number of areas. Our website is being updated, which is crucial. Within education, we've expanded this year. We've had to in the virtual world with webinars, and the new website should facilitate that. All sorts of other applications. In science, we have a clinical research collaboration that's focusing on digital health, and we're supporting a number of EU projects on artificial intelligence, a range of other areas. And where we have a key link across ELF and the other areas of the ERS is in the evaluation of digital resources, also on the regulation of these, and important areas regarding the ethics of these applications. to forward this program. There will be a summit on respiratory digital health, and we'll link, I hope, with other pioneers in the area, the European Society of Cardiology, where we have a lot of commonality of themes and ideas, other groups too, the radiologists who've done a lot of work on artificial intelligence, and also digital health will be a theme for the Barcelona Congress next year. I think we, in particular, have to understand the very rapid digital transformation and acceleration that has occurred, in large part stimulated by COVID over the last year, and understand what has been gained and what has been lost. We gain a lot, but virtual consults, a range of other virtual ways of managing patient care means we lose out on in other ways. And of course, not everyone has access to digital resources, and we want to avoid digital exclusion. Regarding spreading the word across the world with policy and implementation, we will do that, as I mentioned, via work with WHO Europe, and we've already done webinars for Central Europe on chronic lung disease. We're part of a COVID task force for the European Medicines Agency, and also an advisory group for WHO Europe, and there they accepted the importance of involving patients and their families and carers early on, particularly in messaging. I think some of the messages on COVID have not been well handled because they've been developed by policy wonks and other people who are not clear on what are suitable narratives and helpful narratives for us all to understand policy better. I mentioned too the work with the MEP group in Brussels, and the new initiatives with FERS. Multidisciplinary team, that's something very close to my heart. For COVID and delivery of care, then we work completely as a team, not just as doctors and nurses or allied healthcare professionals, technologists, pharmacists, physiotherapists, and so on. It was a team effort. And I think if the team works together and delivers care together, it should be educated together. And so resources not just for medics, but for the team as a whole. We've always done that with NIV, and we're doing that with the respiratory sleep programs, but it can be developed further. And as I mentioned earlier, the whole experience of the patient, the carer, the advocates has to be seamlessly part of that in a feedback loop. So we're educated, we can learn, and we can improve care. Similarly, I think across specialty focus, so working with cardiology colleagues, radiology colleagues is key. For many of those with chronic conditions, it's not just their respiratory care which is important. They may have cardiology input, gastroenterology input, dermatology input, and that needs to be melded together. And then finally, we're not always good at transitions. Transitional care has improved, moving from pediatrics to young adult care and then adult care, but it's not perfect. And there are other transitions which are poorly done, which I'm sure we could improve too. So there are huge challenges for the next year. What do we deliver in the real world or virtually? How, bearing in mind that we're still managing COVID and there may be further spikes and waves coupled with influenza in the winter, how do we manage that? At the same time, optimizing non-COVID catch-up work and also new non-COVID activity. As I said, for the ERS itself, what of our resources should be developed and delivered virtually or in a blended way, which is likely to be the way forward. Particular interest is in shielding. How long do you shield for people with chronic disorders, and how during shielding can one optimize physical and mental health, and then ensure that vaccination and other strategies are delivered properly. So I really look forward to joining you in advancing our joint agenda. Thank you very much. Enjoy the rest of your day, and I hope you join us for the rest of the Congress. Thank you.